Dear friends, today we are discussing about Aphthous ulcer. The word came from Greek word aphthe, which means to set on fire or to inflame. It is also known as canker sores and aphthous stomatitis. Most common ulcer of oral mucosa, persistent BB, recurrent painful ulcers. Most commonly seen in young people between early childhood to late teenage. Now come to the etiology. Genetic predisposition, immunological factors like some autoimmune reaction or immunosuppressive disease, microbiologic factor like HSV type 1, nutritional deficiencies, deficiency of vitamin B12, folate and iron, systemic condition and hormonal imbalance, smoking cessation of smokers, stress and anxiety. Now come to the clinical features. Usually develop over the movable non-keratinized oral mucosa like lateral border of the tongue, vestibules, lips, buccal, mucosa, soft palate, and floor of the mouth. Before appearance of ulcer, involved area produces a burning or tingling sensation. Generally recur in an interval about 3 to 4 weeks. Aphthous ulcers are mainly three types. Those are minor aphthous ulcer, major aphthous ulcer, herpetiform aphthous ulcers. Now we are talking about minor aphthous ulcer. This is the most common type, approximately 85%, very painful, shallow, round or elliptical, and measuring about 2 to 8 mm as seen in this picture. Generally surrounded by erythematous halo and have yellowish gray fibrinous floor. Mostly develops in non-keratinized mucosa, that is inner surface of lips, soft palate, floor of the mouth, and ventral surface of the tongue. In the picture you can see it. It heals up within 7 to 10 days without scarring. Recurrence is very common, usually 2 to 3 weeks in the case of aphthous ulcer, this type of aphthous ulcer. Now we are talking about major aphthous ulcer. It is less common, approx 10%, single and larger in size. Mostly seen in non-keratinized mucosa, but it can also involve keratinized mucosa, that is dorsum of the tongue and gingiva. It heals up with scar formation. Now we are talking about herpetiform type of aphthous ulcer. It is very much uncommon lesion, like less than 5%. It is started by formation of several extremely painful small superficial ulcers in the oral mucosa. You can see this in picture. It generally lasts for several weeks to months. Now come to the treatment part. No specific treatment is found till date. Treatment is palliative. Generally, topical and systemic administration of steroid is useful. In some cases, immunomodulator drugs are also produce some beneficial effect. Recurrence is very common.